My name is Stanley Ntimokam, and I want to show around my room. Circle right there. There we go. So the skill we'll be performing today is administration of medication through a nasogastric tube, with the client having a nasogastric tube. So administration of medication through a nasogastric tube. So to begin with, I want to first of all wash my hands. I wash my hands, I perform my 6 rights. And my 6 rights are right dose, right route, right patient, right amount, right time, and right documentation. After I must have done that, I want to check on the doctor's order, on the medication that the doctors have ordered for the patient. And today we'll be diluting augmentin with 90 milliliters of water, and also we'll have our grounded medication, which is right here, that will be diluted with water. Then the medication that will be drawing up 7 mils. We dry up 7 mils of augmentin dilution, of diluted augmentin. And in the augmentin container, it's been written on it that 4 milligrams for every 5 milliliters. So after I must have done that, put in all my stuff, I'll go ahead and let my patient know what I'll be doing, check the band on my patient's hand, and also check on the computer. Okay, I want to bring all my patients back to a good working position and tilt their head in a semi-forward position. And as you can see, my patient is already connected to the suction machine. So I'll want to go ahead and first of all set my medication, get my medication ready. So I'll go ahead and put on my gloves. Want to put, this cup is 50 ml, so I'm gonna put 50 ml there. So it's 50 ml. Then all my augmentin, put this upside down and put my 50 ml in there. Then go ahead and I'll add 40 mils, making sure that it's 40 mils. That's 40. Okay, that's 40 mils, making it 90 mils of water. Then I'll go ahead my tin container and I'll just shake a little bit. Then I can then go ahead, make sure I invert my container, the cover, put my container here. So what I'll be drawing up is 7 mils. So I want to just put about, let's say, 20 mil, and I will then draw up 7 mil and draw up. So, making sure there are not air bubbles. Okay, that's my 7 mil. To keep that sterile. So so for my grounded medication, which is in here, I'll just want to mix with a little bit of water. dilute with a little bit of water. Dilute that. Okay, diluted. My medications are all ready. So I want to go ahead. I will stop the suction machine. That much I stop the suction machine. I want to clamp the bottom of my tube right here. Take off the connection from the suction machine and I'll clamp the upper part. Okay. Now once I've done that, I'll then go ahead and grab my 7 mils of diluted augmentin. And first of all, before I do this, I'll first of all want to flush with 30 mils of water. So I'll go ahead and put my 30 mils of water right there. 30 mils of water, and I'll be using my syringe right here for flushing. So I'll clamp the bottom of my tube. Take this off. After clamping the bottom, I put that right there. Then I'll clamp it to make sure that no air goes in. Then put my water. Put my water. Let it run down. So let it run down. When it must have run down, then I'll clamp the bottom again. I'll clamp the bottom. I'll go ahead and take my diluted augmentin. Then making sure the bottom is clamped. Put my augmentin in there. As the augmentin runs down, I'll go ahead again and clamp the tube. I clamp the tube. Go ahead, take another 30 mils of water. 30 mils of water. Second set of water. Put my 30 mils of water. Allow it to run down. Allow it to run down. When that has already run down, you go ahead, you clamp it again at the bottom. Then you take your diluted medication right here, you pour it in there and allow the bottom clamp for the medication to run in. When it's run in, you go ahead, take your third amount of water. This will now be 40 mils. We're making it all to be 100 mil of water that has just been put in. So you want to mark that. So after putting your water, you let it run down, and you go ahead, you clamp your tube. You take off your syringe here. Then go ahead, do your final clamping. Clamp it. Alright, you now allow the patient to sit for some couple of time. Allow the patient to sit for a couple of time, about 30 minutes, so that the medication can all be flushed into the system before you then come after 30 minutes. You connect now your patient. You reassess your patient and connect your patient to the suction machine. You clamp the bottom, you take this off, you connect, first of all put on the suction machine, then you clamp the bottom and you connect it to your tubing. Then once you've connected to your tubing, you reassess your patient and bring down the bed. Give them their call light, and you go and chart what you administered, and that is it. You clear your stuff, take off your glove, wash your hands, and you chart. That is it for medication administration to nasogastric tube.